Question number three. I have a 7-year-old with SM. We've been doing exposures for the past 2 years, which includes lunch bunches, which is led by the counselor with one or two peers, and then also some play dates outside of the school. We haven't seen much improvement though. Overall, my 7-year-old is talking to some adults, but with peers, she will play, but only responds with a few words and will never initiate. What else should we try? Should we start medication?
Great question. I want to start with a few concepts. Comfort precedes communication. Progress does not occur in a group. Therefore, we need to build comfort and connection and do specific strategies away from the group. And we do that 4 ways. First way is the buddy process. So it sounds like that's what's happening. Two, play dates with those, or get togethers, in this case, play dates because the child's only 7, with those same buddies, ideally out of school and so forth, and then into school. But also small groups in the room and out of the room. In the room is spot work, working in a small group somewhere in the room that's kind of a set place over and over. But then out of the room, it's a lunch bunch, a friendship group, a recess bunch, working in the counselor's room during resource time, it's called. Whatever environment it is, it's a small group away from the. So that's what a lunch bunch is, and that's why they're doing it. So I love that they're doing the small groups out of the room. I love they're doing some play dates. But what I'm not hearing is the specific interventions they're doing with that child in these environments. Because we often assume set it up, have a lunch bunch, have a friendship group, do a play date, have a small group here, there. That's great. And the setup is there. It's like the frame of the house is there, but it's the nitty gritty of what strategies and interventions they're doing to help the child progress. I used to think really early on in my career, just put them in these situations, build some comfort, and voila, it happens. And I can't tell you how that is just not true. In very young children, with simple engaging and kind of comfort building, yeah, some of them can spontaneously just become comfortable pretty quickly and begin to speak, especially if it's over high interest. That's best case scenario. But as children age, and this child is 7, she's not 3, there's a lot more interventions. It's how you ask questions, when you ask questions, where you ask questions, with who you ask questions, and so forth. In addition, we know the more that we can help lower their anxiety, maybe asking choice questions, maybe using visual supports, all of that lowers their need to think and process the same buddies over and over again. What I'm hearing here is this child does speak. She may not be elaborative, she may not be conversational, she may not be initiative, but she's speaking. What may be missing is consistency in buddies, friendships, actual connection. We also didn't talk about the whys of SM. I have plenty of kids with SM that I see that can speak. They can answer one or two words. They're not initiative, they're not elaborative, they're not expressive. Is that comfort based, or is there perhaps a speech and language challenge, like an expressive language difficulty where putting their words together and saying them and initiating their thoughts is really, really difficult? So I don't know what the whys of SM are with this child. I can say she's verbal with peers and teachers, peers and adults, but she's not initiative, elaborative, and expressive, it sounds like. Maybe more with adults. Is it because she spends more time with adults? So she's gotten more comfortable with adults? Is it that she doesn't have a lot of time or connection with peers? Often now, post COVID, we're seeing kids that during those formative years, in this case, this child was 4 to 6 years of age, 4 to 5 years of age, like she was missing out on social communication opportunities. And if she doesn't have siblings, for example, it's even harder because there aren't children around. So I don't know what the ins and outs are here. I would not start medication right now till I knew what the whys of SM were, what strategies you were working on to help children bridge from kind of just simple one or two words. Sometimes we will help with back forth interview based questions. We'll do different games, activities that allow for question, answer, question, answer. Things like, hi, how are you? Good, how are you? I just started school. Helping them develop these kind of next step questions. I will say that's more worked on in older children. In younger children, it's often kind of through the games and activities. And if they don't have an innate language difficulty, then at home when they're comfortable, assuming comfort's there, they should be more elaborative, especially as people are begin to ask more open-ended questions. So, do you want red or blue? Blue. Why do you want to color with blue? Oh, I like it because that's my favorite color. What's your favorite pet? A dog. Do you have a dog? Yes. Oh, what kind of dog do you have? And asking more open ended, thought provoking questions helps a lot of these kids develop those skills. But if teachers are only asking forced choice questions and not really asking questions, and we hear this a lot that they don't ask a lot of questions because they don't want the kids to be anxious, but it is about facilitating. Don't wait, facilitate. So, what I'm hearing right now are the need to develop accommodations and interventions based on this child's unique needs, which involve understanding the whys of SM and the baseline stages of social communication to know what stages we're bridging up to and knowing when to bridge down. The larger the group, the more you're going to bridge down, maybe. Meaning, like if you're verbal in a small group, you might be using transitional strategies in a large group till they can get a little bit more comfortable or sitting closer to the teacher so the teacher can purposely ask questions. But again, prompting other kids to go up to this child and ask some questions. Where is your math book? Did you do your homework? Do you want to play outside? Like there's lots of things that we can do as adults to help facilitate the next steps in social communication to help this child become more expressive, elaborative, and initiative, assuming there are no innate challenges such as speech and language and so forth. And again, is this child bilingual and only feels comfortable in the language these other kids are speaking? Or is she not comfortable in that language these other kids are speaking? So there's just so much more to this question that I'd want to know to really be able to help direct.